group of leading cardiologists have issued a chilling warning. The global rise in heart failure and related deaths can be directly linked to a cardiotoxin produced by Covid mRNA vaccines. According to top cardiologists in New Zealand, the spike proteins generated by mRNA vaccines are now officially recognised as cardiotoxins, substances that cause severe and usually irreversible damage to the heart. Their findings, published in peer-reviewed research, point to this toxic protein as the primary culprit behind the alarming surge in heart-related illnesses and fatalities worldwide. Experts now caution that the evidence is undeniable. Covid mRNA injections have triggered a sharp increase in heart attack deaths globally.
It is my duty and responsibility as a consultant cardiologist and public health campaigner to urgently inform doctors, patients, and members of the public that the Covid mRNA vaccine has likely played a significant role or been a primary cause of unexpected cardiac arrests, heart attacks, strokes, cardiac arrhythmias, and heart failure since 2021, until proven otherwise.
With many leading healthcare professionals stepping forward to sound the alarm, the time has come for a serious public discussion about the true risks of these vaccines. One place we know this honest and frank discussion will not take place is the mainstream media. According to the establishment, they don't know what's causing the explosion in cancer rates and heart failures, but they do know it's not the vaccines. Don't waste your breath asking them to explain their logic. They're not interested in hearing from real people or acknowledging their experiences with the vaccines. This is exactly why the regulators have consistently refused to conduct a vaccinated versus unvaccinated study since the 1980s, when vaccine companies were granted immunity from liability. It's not about transparency or public health, it's about protecting a system that puts profits and power above accountability. Thankfully, so-called fact-checkers are rapidly becoming a thing of the past, with Mark Zuckerberg finally admitting Facebook's recently fired fact-checkers were biased and spreading fake news on behalf of the establishment. The truth is, you can fool some of the people some of the time, but you can't fool all of the people all of the time. The so-called fact-checkers were exposed when the undeniable surge in heart disease among unusual demographics became glaringly evident in hospitals worldwide. Doctors are raising the alarm as hospitals see a dramatic surge in young patients suffering myocarditis, pericarditis, and other severe heart conditions. While the CDC and legacy media claim that these vaccine-induced conditions are not serious, the truth is beginning to leak out. They are deadly serious, with an emphasis on the deadly. The Cleveland Clinic, that bastion of establishment medicine, has quietly admitted they expect 50% of these myocarditis cases to be dead within 5 years. Renowned cardiologist Dr. Thomas Levy has also issued a chilling warning to the 100 million Americans he says now face irreversible heart damage due to the vaccines. Dr. Levy's research estimates that heart injury occurs in at least 2.8% of those who receive the injections. By his calculations, a staggering 7 million Americans who were vaccinated in 2021 are already dealing with severe heart damage, a number he believes could now exceed 100 million. Dr. Levy shared with vaccine data expert Steve Kirsch that the spike protein's impact on the heart is far worse than anything he or his colleagues ever imagined possible.
So I want to lead off with something shocking just to get people's attention on this, that I project, it seems that at least 7 million Americans have been injured by these vaccine shots. And the government's not owning up to any of it. They just say it's mild and rare. Now, 7 million people isn't rare, at least in my book. And it could be a lot more than that. It could be 70 million people or even over 100 million people. But let's just start with the 7 million figure. Would you agree with me on that? And we'll talk about the reasons why.
Yes, that's what the literature reflects at the minimum, as you said.
Okay. So I wanted to get back to my original question, which is, could it be 100 million or more? And you said, well, it could be higher. Could it be over 100? Is it possible? Is it within the realm of possibility, knowing what you know about all the data that's out there, including things which are not yet disclosed to the public? Do you think it's possible that we could have over 100 million people who had some amount of heart damage from these vaccines? Yes or no?
I certainly think that's possible, yes. Okay. There's no way to say so for sure at this point in time. Until
but it's within the realm of possibility.
Testing is done, but absolutely within the realm of possibility.